Cracking the Code. Lessons from the best international companies to enter the US MedTech market in 2024.
Good morning. Good morning. So, I don't know if you've heard, but there was a little election in the United States about 36 hours ago. So I want to share 3 thoughts before we get into the formal presentation about what that portends for companies all over the world looking to launch in the United States. And I thought about this, and this boils down to 3 M's: manufacturing, MSET, and MDUFMA. Manufacturing. For companies who are thinking about producing part, some, all of their devices outside of the US, I believe what you can expect over the next 4 years is increased tax incentives to drive manufacturers to go from concept to commercialization, making parts all entirely in the United States. MSET. For those of you who have been around for a while, you remember that there was a guaranteed coverage for devices that had earned breakthrough designation under the Trump administration. Now that Mr. Trump has returned, I think you can expect some legislative and executive action to push for some return of that program called MSET, which was the catalytic stimulus for breakthrough device designations for the prior 4 years. MDUFMA. MDUFMA is a user fee program that drives hiring of at least 30% of the personnel at the FDA. As you may know, we have a range of leadership in the United States, from the Secretary of the Department of Health and Human Services to the agency head of the FDA to the Center Director. The Center Director, Dr. Tarver, will likely signal her priorities, which she's already said are for patient innovation and putting the patient first, and how she uses those user fees. And because we see a lot of capital still going into digital health, you may see headcount from those user fees going into personnel who have expertise in those areas. So those are the 3 M's for the new Trump administration. So let's buckle up. Now to the presentation. We're going to talk about 3 main areas. What is the investment climate, not just in the United States, but throughout the world? What that portends for companies, again, looking to launch in the United States? What are the key trends from a business and technology perspective? And then 3 key lessons. And then I'll let you go. So consistently, over the last several years, we've seen the 3 major sources of capital throughout the world come from investors. Dylan and I were just talking about investors a few minutes ago in North America, specifically the United States, Europe, and Asia. Within Asia, we are all aware of the massive amounts of capital and innovation going on in China, but we're going to talk about another market that, to me, I feel like I'm late. I got the memo late. We're going to talk about a very specific market in Asia Pac to watch in terms of innovation. So I'm going to run the risk of telling the same joke 2 years in a row. Why did the bank robber rob the bank? Why? Because that's where the money is. Why is there so much activity in digital health? Because consistently over the last 10 years, that's where VCs have poured capital. I love traditional medical devices. I grew up evaluating pacemakers and defibrillators, but for sure, at least 1/3 of the clients that we work for have SAMD solutions, and we will continue to see that as VCs continue to deploy their dry powder. I know it may not feel like this, but I am fairly confident that 2025 will return to the norms that we saw before the pandemic. Even though we see in the macro environment in the United States that interest rates are coming down and investors still have money to deploy, I don't think we'll ever see the days of 2020 anymore in terms of activity of deals, and we'll talk about deal flow in a few minutes. This shows digital health investment in just a different way. It's almost a perfect parabola. If we were to go out to 2019, which we're describing as pre-pandemic, we would see that if we get through the rest of 2024, the relative deal amount and particularly if you could extrapolate to 2025, will be similar to what we've seen in 2019. So the news here is that digital health investment has seen its highest level activities in 2020, and we're going to return to more typical numbers in 2025. So I talked about this a little bit. How many people in this room have raised a seed extension round? Raise your hands. Yes, indeed. I knew it. I knew it. I knew it. So a key for 2023, 2024, and I believe into 2025 is to raise $2, $3, $1.5 million to reach a meaningful milestone to unlock that Series A or potential pre-Series A round to keep your company in that forward momentum trajectory. The importance of de-risking activities related to FDA are ever increasing in this economic environment. It could be something as simple as completing your biocomp, studying your device in 5 mini pigs, or getting to that first 5 first-in-humans in Georgia, not Georgia, United States, but Georgia, Eastern Europe, or Houston in the United States. But surviving and raising enough capital to get to a meaningful inflection point will be key for 2024 and 2025. I mentioned that Dr. Michelle Tarver is the new center director at the US Food and Drug Administration, and I believe as an institutionalist focused on innovation, what we can see from Dr. Carver and expect from Dr. Carver is a consistent or slightly increase in the amount of guidance that she promulgates to benefit innovators like yourself. In my opinion, in my estimation, and I was fortunate enough to work with Dr. Tarver at the FDA for 12 years, the 2 key levers that the FDA can use to drive innovation are the people they hire with the right expertise and the amount of guidance that is clear and meaningful for companies. Everything from cybersecurity to the change control process for SAMD and beyond. I want to talk about a market that I have never seen discussed in any MedTech panel in the last 22 years. So is it a relatively small market compared to the United States? Yes, in terms of revenue, the work going on in Africa is 1/10 of what we see in North America. If there are some significant and continued improvements in the regulatory framework and/or continued launching of innovation ecosystems like we recently saw the biodesign program in Kenya, this is an area over the next 10, 15, 20 years that I think is ripe for innovation in MedTech. I want to remind everyone, and I think we have some colleagues from Israel, that US, Europe, and Israel, in terms of truly innovative regulatory applications, still lead the way. But here's a little nugget. When you look beyond China, the area of growth for 510Ks is in South Korea. So if I'm not going to have any more children, but if I were to have a child right now, I may send them on a gap year to Korea to continue to explore how that innovation ecosystem is building up. What does it take for the very best companies to not only survive till 25, but to thrive? One, strong partners with lasting and long-standing capital. A company in the image analysis space partnered with a large strategic based in South Korea to enter into a channel partnership to drive revenue as they enter the United States. And I think this is a key attribute for companies that succeed in this current macroeconomic environment. Yaya Scientific is one of approximately 5 ARPA-H funded companies we work with. This is a gem. ARPA-H is a billion-dollar agency that is deploying capital and will continue to deploy capital in companies based in the United States for the next several years. And they write checks between $2 to $20 million, all focused on getting that innovative technology to market. Finally, milestones that matter. Raising that bridge is key, and it can be, again, something as simple as getting your preclinical data finalized or getting that first 5 humans studied in the US or abroad. I would increasingly seek out partnerships with individuals and entities that are patient, because we still have some ways to go to get out of the macroeconomic doldrums that we've seen in 2023 and 2024. I wouldn't have been able to put together this presentation without my collaborators at the Future List and my good friend Christian Johnson at Scout Medics. A lot of the data and analytics you saw is because of their hard work, so I want to thank them. And I want to thank you. I know I'm over. This is how you can get contact with me, learn more about the firm, and download this presentation. I am so thankful to have been a part of this for another year. I want to thank Gio and Dylan. I didn't know you guys liked each other so much. You guys like each other. The energy is really palpable. Thank you, Yulia, for everything you've done, and I look forward to spending time with you over the next 2 days. Thank you.